Hey guys, Andrew Lee here, your admin over at the California Insurance Agents Group and CEO of Health Mutual Network. So I'm just going to get into today's topic. Today's topic is going to be 5 common objections that health insurance agents get. Okay, so what you're supposed to do as a Medicare agent, let's say, right? You may encounter various forms of objections from potential clients. It is just what it is. That is the game that we are in, and that is just the life we chose, right? So here are 5 common objections that I normally get and some tips on how to address them. So, objection 1 is going to be I am not sure I need Medicare because I'm still working. Now, we're going to address this objection by explaining the importance of having Medicare coverage and even if they are still working compared to two, right? So, even if you're still working, Bob or Jane or whatever the case is, whatever their name is, Medicare still will provide you additional coverage and protection for you and your family if there is a spouse in the house. And these plans are designated to pay out to help you pay for medical expenses and of course, protect everything that your employer-sponsored plan may not have. So if they already have an employer coverage-based plan, then you want to, of course, compare the Medicare plans available to them alongside their current policy. So another one is, hey, additionally, Medicare can give you the help that you would need, so you don't have too many out-of-pocket costs, depending on if you're going to get them a Medicare Advantage or a supplement plan, so that there aren't too many out-of-pocket out-of-pocket costs that financially burden you and your family. God forbid if something happens, if you guys are injured, sick, whatever it is. So, wouldn't you rather have that kind of peace of mind knowing that you chose the best kind of protection for yourself, right? So, again, that's just if they're offered coverage, you would definitely want to compare the two together. If they're not offered coverage, then let's discuss your current situation right now, and let's go into what Medicare will, of course, cover for you as well too, and how this all works. Happy to walk you through that, right? We can explore all options together, and we just got to make this affordable for you, and make sure your copays aren't too high. Your cost of medication's low, doctors in network, all that good stuff, right? So that's how you clear objection number 1. Objection number 2, okay? I'm not sure that I can afford Medicare supplements. Now, if you guys are in the Medicare field, you guys know that clients will call everything a Medicare supplement that has to do with something that's going to help cover the 20% left behind by original Medicare. Okay, I'm not sure I can afford Medicare supplements. So we're going to address this objection by highlighting the benefits of what a Medicare supplement actually is, and if they actually meant a Medicare Advantage plan, because some people will confuse a Medicare supplement to a Medicare Advantage. Oh, I saw that Medicare supplement thing on TV, right? You guys have heard that before. So what we're going to say is Medicare supplements can help you with out-of-pocket maximum costs or out-of-pocket costs and any financial burdens that are going to have, that are left behind by original Medicare. So without a supplement, you're going to be responsible for paying 20% that's left behind by original Medicare, and that's not including medication or dental and vision. Anything that's left behind by original Medicare, you're going to be on the hook for paying 20% of it. So for example, if you had, I'm just going to exaggerate, $1 million worth of hospitalization that you owed, you're on the hook for 200,000 of it, and that does not go away. Every single time that happens, you're on the hook for 20%. Let's say you just had a crazy year, and the month after you got hit with a $100,000 hospital bill, right? It was just a weird year, terrible bad luck that year. Then at that point, you're still on the hook for 20% of what it is. So just because you pay $200,000, that doesn't mean that you're not paying another $20,000. It does not go away. So we need something to supplement your current original Medicare. So of course, give them the risks, have them realize the risks, and then you go into what will cover those risks or those exposures. So hence, a Medigap plan. So what I would say is let's explore options that will be affordable for you and that is going to be a good fit, customized for your situation, the number of doctors that you go to, what kind of medications you're taking, and then we can discuss all of that. So that's when you get into, if they're a good fit for Medicare supplements or Medicare Advantage plan. You guys as agents should be able to discern the two, and if you're using good knowledge, then you know what plan you're going to get them, right? We're going to, tell them, hey, we're going to think about the long-term benefits. You're going to have Medicare for life, right? This is going to be your coverage for the rest of your life. So let's get you something that's going to be of peace of mind, knowing that once we set this up, you're all good to go. If there's any changes in the future, of course, let me know, right? So again, you want to make sure that, I can't afford Medicare supplements. Well, you don't even know the price. Right? And are you talking about a Medicare Advantage? So we definitely want to discern that. Okay. Objection number 3. I'm not sure which Medicare plan is right for me. Well, so you would address this objection by asking the questions beforehand and understanding their needs when you're doing a needs analysis. And, it's our job, what I would normally say is it's our job to get to work for you on this. There's a whole reason of having an agent. So what are your top priorities when it comes to having Medicare coverage? Is it affordability? Is it the coverage itself? Is it something else that we don't know about yet? So we definitely want to keep asking questions, right? Can you tell me a little bit more about your health status, right? Any medical conditions you might have? This is going to help me sort of digest what you're needing and then, come up with a solution for you. So let's go ahead and review a couple plans together just based off of your situation right now. And then I can go ahead and explain the benefits, the coverages, the cost of the plan, the reputation of the company, anything that I need to explain to you, any questions you have, I'm here to answer them, right? So you cleared that objection, and that's a pretty easy one. Objection number 4 is I'm not sure I want to deal with the hassle of switching Medicare plans. So if somebody is on the fence and reached out to you for a certain reason, there has to be a reason why they reached out to you, whether it be, a lead that you got from Facebook or a telemarketed lead or somebody that just, they reached out to you somehow via grassroots and said, I needed help with Medicare, and you get into, okay, what's your situation? How can I help? Well, actually, I'm not sure I want to deal with the hassle of switching Medicare plans, right? So we're going to address this objection by emphasizing the benefits of working with a reputable agent like myself, right? So what I would do is I would say, I understand that switching Medicare plans can be overwhelming. We don't like change, right? Seniors generally don't like change. We don't like change, but, I'm here to guide you through the process. So I'm going to handle all of, the paperwork, the communication with the insurance company, but I just need to make sure that something works for you, right? I need to make sure that you're happy where you're at because, again, you reached out to me for a certain situation, and I understand that switching plans isn't the most optimal, but as your agent, I'm going to work on this so that your transition is seamless, especially if the plan that we're going to now go with moving forward is going to be a fit that's going to be more optimal to your situation, your doctor visits, your prescriptions, and anything in between, right? So we're reassuring them that as your agent, we do all the heavy lifting for you, so there is no really hassle, and it's free to work with us, right? We just need to find something that's going to work for you right now. Of course, right now, the plan that you have is not, is not the one that's going to be the best available out there, right? So we definitely want to make sure that we're selling ourselves as an agent and garnering trust by saying that we're going to take care of all the heavy lifting. You don't worry about this. We just need to make sure that the plan that you want you're okay with, right? And let's go ahead and discuss your new plans as me as the agent, and let's see how we can improve your current coverage right now, and then reduce your out-of-pocket maximums, reduce your co-pays, anything like that. Any plan that's going to fit your budget per month for your co-pays, right? Or if it's a supplement for your monthly premium, or a premium on a Medicare Advantage, whatever the case is, right? So that's how you address that. Objection number 5. I'm not sure which plan I should go with. Do I need a Medicare Advantage, or do I need to stay on original Medicare? So we're going to address this by explaining the benefits of both, right? Now, everybody should do this in their initial call, initial in-person visit, initial Zoom meeting, whatever the case is. What you're going to want to do is side by side explain to them the pros and cons of both, right? I normally just tell them to, hey, do an imaginary T-chart and let's see what is going to be a good fit for you, whether it be, so we'll just list out all the pros and cons, right? So, the pros to Medicare Advantage, generally in our area at the very least, $0 generally has, it's built like a Medicare health plan, like a regular health plan, has a lot of features to it that original Medicare does not have. But of course, if you wanted to stay on original Medicare, then of course we have to get you a Medicare supplement, and on top of that, a prescription drug plan at the very least, and then some ancillaries if they need additional assistance with their coverage. So Medicare plans are going to provide you, ma'am, with additional coverage that original Medicare doesn't offer. So let's go over what you're actually needing, because from here I can tell you which one that I think that we're leaning towards based off of your specific situation. So again, it's all based and customized off of your client's situational needs, right? Everybody's built different. So you're going to really have to ask questions and dig deep. Let's discuss your current coverage right now and just see how Medicare Advantage or a Medicare supplement will improve your situation with just having original Medicare, or whether they have original Medicare and Medicaid, Medi-Cal, whatever the case is. We can explore all those options just to make sure everything's affordable for you, all the doctors in the network, and everything just works out. Now, think of the long-term benefits, ma'am, or Susan or Bob, or whatever the case is. Think about the long-term benefits. Again, we're going to have this for the rest of your life, so we don't want you to have any financial stress just over picking the wrong plan. And we definitely want to do this right the first time. Of course, if your situation changes in the future, we can always adjust, right? There's open enrollment periods for that. There's underwriting holidays for that, all that good stuff. So those are 5 Medicare common objections that I've seemed to get. And a lot of you guys have of course run into these objections. Remember, when you're talking to them, listen actively, because there could be a small little nugget in there that they're saying, and that could have just gone over your head, and that could have just been the shift of the whole conversation in terms of what they're needing, right? And of course, educating them about something that they don't already know that exists out there. If you're the first person to break that news to them, guess what? You're looking good. You're looking like agent number 1, because again, your clients are shopping, especially during the AEP period, especially when they're turning 65, with all the mail and all the stuff that they're getting, the phone calls, the commercials, all the people that are calling, that they know, and financial advisors tell them, hey, it's time to do this. Are you ready? Blah, blah, whatever the case is. Just make sure that you're actively listening to whatever they're saying. Ask questions and address their concerns, and customize those questions to those concerns, and in a pretty clear and concise manner, because you got to keep this simple, right? Seniors want you to keep this as simple as you want, because they're already overwhelmed. They're already coming in like, man, I really just don't want to do this. And your job is to make sure that they get off the phone, or they get off your appointment saying, that makes total sense. Oh my goodness, what a relief, right? So as soon as you hear that, you're good to go, right? You're their agent, and hopefully you're their agent for life. Just do a good job of course, addressing customer service whenever they do reach out. All right, guys, I'm gonna give you some bonus materials as well too. So here's 5 common objections health insurance agents get in general, right? Let's even call it with ACA under 65. So I already have health insurance, so I don't need to switch. All right, this is another good one that I get for people who are under 65 on Cover California. Now, you already have health insurance. I don't need to switch. You can address this by understanding what kind of current coverage they have because everything is through the exchange, anyways. So, are you reaching out to me for a lower pricing? Like, can you tell me a little bit more about your current health plan that's got you shopping right now? Are you satisfied with the coverage that you have and the benefits that you're receiving? Have you experienced any issues, or is it the limitations with your current HMO, or whatever the case is? Are there any limitations with your current plan? You definitely want to highlight, the benefits of the new plan coming up, but especially if it's a better situation. But you definitely want to do, a needs analysis, like I mentioned. Listen to the client, right, and ask the right questions. Now, objection number two: I'm not sure that I can afford health insurance. Now, this is going to be emphasizing the importance of having health insurance and, of course, the financial risks of not having it. Of course, the exposures of not having health insurance is a big deal, but just not having health insurance in general in California, you still get a tax penalty associated with not having it. So, at the very least, have something, at the very least, a bronze plan, minimum essential coverage, so that, God forbid, you go to the hospital and you're not paying out thousands and thousands of dollars. It's pretty easy to rack up $100,000, $150,000 bill these days. So why not at the very least have some kind of coverage to help you out, right? It's number one. The number one reason why people become bankrupt in this country are medical expenses. Let's just be real. So if you don't have coverage, then we have a huge liability, right? We have a huge exposure. So I understand that the premiums could seem high. Of course, this is based off of income. I understand that premiums can seem high, but let's think long term. Let's think about your family, right? Like, how can we not have health insurance, right? So let's explore some options that are going to be more affordable, and I'll work with you on this, of course, on the budget. Work with you on realistically how much are you going to make this year. Really see what their actual income is and if they've over projected their income, right? So we can discuss subsidies, we can discuss the discounts, all that good stuff, incentives to help reduce your premium costs, right? Objection number three I get also for Cover California plans: I'm not sure what plan is right for me. Well, the cool thing about that is that it's my job to walk you through this. So we're going to first have to understand what your needs are, right? So we can get you the right plan. So I'm going to ask, what's your top priorities when it comes to health insurance? Is it more the price, the affordability, the actual coverage itself, or is it something else, right? Can you tell me a little bit more about your health status right now? Do you need, hospitalization coverage? Are you going to the specialist more than twice a month? What's your current situation? What's your current medical situation right now? And that way, this is going to help me tailor make your policy the way that you want it to be made. So make sure they walk you through exactly what it is. If they're not opening up, you haven't gained trust. You don't sound like the expert. You don't have the tonality. You don't have XYZ, right? So make sure that you're confident. Make sure that you're asking the right questions, and they're going to open up to you. No problem. I would say let's review different plans together. I can explain all the benefits, the coverages, the cost of each plans. And then from there, we're going to find which exact plan is going to be a good fit for you. And hopefully you're happy with that. If not, let me know. Let me know because anything can change. Objection number four: I don't want to deal with the hassle of switching insurance companies. Again, that's the same thing that, we get with Medicare clients. But, on the ACA side, it's, especially if it's on exchange on Cover California, it's all on the same exchange, really. And I understand that switching insurance companies can be overwhelming, but there's always a reason why they reached out to you, or they're a prospect in the first place. If they're not, then have the tact, read the room, and just get out of there because that's not the right client for you, right? But I understand that switching insurance companies can be overwhelming, and I will be the one that's going to guide you through this process. So I'm going to be the one, helping you communicate with the carrier and handle all the paperwork, so you can focus on, what you got to focus on in terms of, just being healthy and just using your insurance correctly. As your agent, I'm going to work with you on this transition. So don't worry about that part. What we want to do is make sure that you're on the right plan, right? And that you're satisfied with the coverage that you have. So, something like that, reassuring, and then get into it, okay? And it doesn't hurt to check, if there's going to be anything lower in terms of premium. It doesn't hurt to check. If there's going to be anything lower in terms of copay, it doesn't hurt to check. It doesn't hurt to check. It really doesn't. It's free to work with me too. Objection number 5. I'm not sure I need health insurance right now because I'm young, I'm healthy, right? So, to address this objection, you're going to, again, highlight the importance of having health insurance. And of course, at this point, if somebody's young and healthy, of course, their incentive is a lot lower, but, you would bring out some stories that you tell with your clients that are in their 20s, early 30s, whatever the case is, about, some exposures that your clients have had, their experience before that, if they're in the same situation as the client that you're talking to right now, their experience before when they thought that they were healthy, everything was good to go, their experience while they had, let's say I had plenty of, clients that are in their 20s, but I had one that had a rare form of cancer that she really, at the beginning was pretty, against having coverage at all. But, her mom sort of, helped her through, making the decision on getting health insurance. She ended up getting some kind of rare bone cancer. And, at that point, the insurance pretty much saved her hundreds of thousands of dollars, right? So if you're young and healthy, great, accidents can happen. I know it's not going to be every day, don't use this as a scare tactic as well too. I hate when people use scare tactics to sell things, but I get that accidents can happen, but you're going to want to bring value instead of using scare tactics, because nobody's going to buy scare tactics. It's the value that they perceive, right? So, even if you're young and healthy, emergencies can arise. I mean, you can break a bone, if you're playing sports, whatever the case is, you still want to have something, Additionally, if you have coverage, you have the benefits of going in regularly just as a checkup, if you're needing therapy, if you're needing, whatever the case is, blood work, checkups, just things that we have to do in general. You would probably want to utilize that, would you not? Right? So that's another reason why people that are younger would want to use health insurance. And from there, we're just going to discuss different plans. But of course, I know that you're young and healthy. If you're young and healthy, let's go with the policy that's going to have a lower premium based off of you being healthy, right? So if there's going to be a policy that at the very least has an out-of-pocket maximum, a cap, so that they're not in a situation to pay all kinds of money, God forbid if something happens, and it's an affordable rate per month based off of their income or whatever the case is, based off of their budget even, then why not, right? So remember, guys, actively listen. If we're going to take anything away from this, actively listen to what they have to say. Make sure that you're putting them on the right plan, and make sure that they're fully understanding what you're talking about, because you can say everything you want. You can word vomit. You can read off a script, not put your own tonality into it, and just say words, and they're just more confused at this point. Make sure that you're building a connection with your clients and that they understand everything that you're saying, right? With statements like, does that make sense? Right? Any kind of tie downs. Does that make sense? Is that making sense? Is that something that you wanted to go with? Is that something more up your alley? Just sort of gauging where they're at. You definitely want to ask questions in between. Don't just go out and just spew out words, because at that point you're talking at them, not with them. So guys, I'm going to sign off, and hopefully that video very much helped. Again, if you guys haven't liked and subscribed, please do so we can come up with some more content for us California-based insurance agents. And with that, I will bid you guys farewell, and I'll see you at the next one. Thanks.